Here's a title that grabs attention. How to Survive the 2 Midnight Rule, Lessons to Prevent Financial Disaster. This is Cathleen Biga, RN MSN, who is President and Chief Executive Officer of Cardiovascular Management of Illinois. This is a big topic. Can you remind us again what the 2 Midnight Rule is and why this is so important?
Well, the 2 Midnight Rule was supposed to help us. It was Medicare's attempt to facilitate the definition of a patient status. So when is a patient considered an outpatient and when are they considered an inpatient? And the rules used to be based on intensity of service, severity of illness, very difficult for both physicians and staff to figure out. So in their wisdom, CMS decided that the 2 Midnight Rule would be a presumption that if a patient stays in the hospital and crosses 2 midnights, they would be considered an inpatient. And if they did not cross 2 midnights, it would be assumed that they would be an outpatient. And that's the genesis of where we're at today.
And so why do you want to try to avoid the financial disaster that you talk about? That kind of was a surprise to some people.
It was a surprise to some people, and some people think that because the audit process has been delayed, that in reality the 2 Midnight Rule is not in existence, and that's not the case, yes. However, very much so, the 2 Midnight Rule is in place, and actually the moratorium, for lack of a better word, on the actual audit process also expires this April. So it is important for people to realize that the audits will actually take place and are in effect. The financial disaster. In our cardiology world, so much of what we do can really be done probably in less than 2 midnights. Specifically, our cardiac caths, our interventional procedures, our EPs, our devices, for the most part, those are outpatient based. So if you think about a hospital's perspective, the delta or the payment between a DRG payment and an APC payment is quite large. And so if we shift our patients into the outpatient world too quickly without eliminating some of the cost that goes along with that, there's your financial disaster. So what we talk about is how physicians and their hospital partners can facilitate safe patient care with great quality and still meet the 2 Midnight Rule, because it's here to stay.
And what are some of those points?
So one of the things that we have done most successfully are same-day discharges when appropriate, making sure that our patients are well educated prior to the procedure that they're having so that they know that they'll go home, so that we have the resources to take care of them, making sure from a socioeconomic perspective that they're ready, and from a clinical perspective that it's safe for them to be discharged home. So that's probably the more common one. The second thing that hospitals and physicians need to do is to just identify where their cost is coming from, and that is very difficult to do because in our outpatient world we have to have what I call time date stamps. We need to know what our length of stay is for our procedural patients, and that's not something we tracked before. That's where you need to start, taking a look at all the cost of your patient, because whether they're there for 1 midnight or 30 hours, you're still going to get paid one amount. So how can I take care of them most efficiently, highest quality, great outcomes without a lot of cost? The triple aim.
What's the cost savings in general? Is there a difference between, is it 100, is it twofold, threefold?
Well,
what's the difference between
inpatient,
doing it right and doing it poorly?
Well, I think the first financial disparity is the difference between the APC payment and the outpatient and the DRG payment, which is considerable. 2 times, sometimes 3 times. Okay. So the hospital gets paid much less in the outpatient world. So that's the number one financial. The second component of that, the financial savings, a little bit harder to grasp. But in order to do that, you really have to be able to analyze your patient cost or your case cost. What's the length of stay? What is your supply cost? What's your pharmacy cost? What's your lab cost? And what's your imaging cost? Complicated, but that's where we're heading in our service lines.
And you can also search on acc.org for information on the 2 Midnight Rule and also for information from Cathleen Biga, because she has provided us with information in the past. For CardioSource World News, please see our cover story. I'm Executive Editor Rick McGuire.